Hi. Hi, sir.
Hello.
Hi. Yes, we'll be starting the webinar now. Welcome, everyone. Thank you for your joining us for today's webinar on virtual conference on traditional and alternative medicine. My name is Swati. I am your host for this meeting. On behalf of the pages, we are very pleased to welcome you to share and witness the advances in the field together. And we specially thank our sponsors, Marine Products, Humira Groups, Humira Functional Foods Company Limited USA for sponsoring this webinar. Your support is gratifying. We hope that our association continues for further events. Thank you once again for joining the webinar. And we begin the webinar with a talk from the speaker, Dr. M.H. Rafiq from University of Colombo, Sri Lanka, and the talk will be of overview of future aspects of complementary medicine. Dr. Rafiq, you can continue with your talk.
Good morning. I'm here due to the current electricity problem. We are a little bit slowing. Give me a 5 minutes time of the country situation of the power cut. Everyone, you are hearing me?
Yes, doctor, we can hear you. Yes.
I'm very sorry. My country is these days power cut. The electricity is problem going on. So that's what's delayed with organizing certain things. I am going to talk regarding about alternative medicine and complementary medicine future aspect. As we know, we are qualified in allopathic medicines, and today the market of the future of the people who are looking for nature life, nature curing, and they are seeking without any side effect. Mostly the nature way of the healing part, it's a number of the complementary therapies are available. We can say it's A to Z therapies are here. There are certain therapies are very good result without any side effect. So we have to combine integrated way to do the medicine, the helpful for the our community and human being, take care of the well-being of the health. So my point of view, I am the 35 years of the alternative and complementary medicine. I practice mostly Europe country and Middle East. I worked on the so many cases, which is mostly pain management, then chronic illness. As we know that chronic illness are various type of problem, internal part, external part, immunities, various therapies with the medical doctors who are specialized MDs and physicians. All of them are seeking the knowledge of the complementary medicine. Why? Because of they are most of the patients who are chronic cases, managing part is can help to the medical way, and the complementary medicines can helpful for the certain period of the time. It's helpful. My point of view, my experience of the alternative and complementary medicine, integrated medicines, I have gone through the number of the arthritis case and joints pains, spine problem, migraine, and gastrointestinal IBS, psychosomatic problem, stress, and headaches. These are the most advanced cases, are more result, more benefited. But can you think about the complementary medicine A to Z, acupuncture, biomagnetic therapy, color therapy, and then we can say magnetotherapy, then acupressure, then various detoxifications, herbal medicine, and then we can say about detoxifications. Those are very classific way helping to the human body. But the way you practice, the way you get to experience each and individual, we have analyzed the patients, analyze the situation of the condition, and various depend on that condition. So we have homeopathic medicine, via homeopathic medicine, via individually reputations we have to take it, clinical history we have to take it. Herbal medicine is entirely different, each and every one. We are giving the patient, for example, for the memory, we'll say reducing the memory, age calling. The ginkgo biloba herb is a very good herbs to give the ginkgo biloba. It's a very good. Sometimes the nutrition also important, but most of the medical doctors practicing nutrition, some of them are not interested about the nutrition, but nutrition can take as a tablet form or fruits and vegetables form also can take. So what do I want to tell you all? We are all our practitioners. Patients need complementary medicine. What we are looking, the patient needs sympathy. So allopathy, homeopathy, osteopathy, the patient finally needs sympathy. That's what the patient looking. And even we are a certain system, main system, the digestive system, the stomach system, you have to be cleansing a system, balance the system, energy flow, yin and yang, energy flow, acid, alkaline should be balanced the system, drink more enough water and fruits, where chemicals to be avoid, more chemicals should be avoided. And same time, we are the people who are mostly stress. The stress is one of the main causes of today. Every time they are looking at the everything's timing and minutes and all things. These are making us a nervous and negative thoughts. We should be a positive thoughts. We have to be helpful to the people, and more laughing is one of the medicine, relaxing the medicine, advising, counseling, and helping the patients. If you cannot treat the Western medicine, try to give them to that allopathic, the alternative medicine, complementary medicine, integrative medicine. So many way of the helping the patient. We have to give the space to them to do that. But that is what we are doing. But you see, some of them are they keeping holding. They are the best in the hero, but finally nothing happened to the patients. So what my point of view the complementary medicine. Now, for example, I have a patient of the guy who's I'm reading now here. He is suffering from the osteoarthritis more than 2.5 years. So they have osteoarthritis. Could be that knee pain, but he has a vitamin D deficiency as well. So we must know that vitamin D is where educated. You have to give the patients. You can give it with the food system or natural way of the sunlight early morning, and that is also good. So we have to supplement. We have to give that same time. We have to give the supplement medications as well, and physio treatment with acupuncture, physio and manipulations, everything, and dietary advice, weight management, ligaments to be manipulated, and so many things are involved. So we must be advised. First thing is we are looking the patients more time to concern about discussing the history of the patient and advising the patient. This is the one of the most important. But today, when you go to the doctors, they are little bit time and they are giving the medication, chemical, advanced technology is going on, toxin forming the liver, getting the device. Have to give the space of the complementary medicine also. I think any questions, let me know. I can give you my experience.
For the insightful talk. Now the stage is open for questions. If anyone is any speakers are having any questions regarding this talk, please you can ask Dr. Rafi. Can you hear me, sir? Now?
Now, okay? Can you?
Yes. Have you done with your talk, sir?
Pardon?
Are you done with your talk, sir? Is the talk is over?
It's still not clear. The last word.
Is your talk? Are you done with your talk, sir? Is the talk is over?
I slapped you now.
Hello.
Did you complete your presentation, doctor? Rafiq?
No, not yet, not yet.
Yes, yes.
Give me
Please
a
carry
2 minutes time. My internet's giving some slow, and I will be back to the 2 minutes time.
Sure,
Any
sure.
question
Continue.
any
No
question you
questions.
can ask me?
No questions at all. You can please continue.
Yeah, please. Give me that slide show. My alternative.
No. Very a passport. He told to record.
Can you hear?
Yes, sir, we can hear you.
I'm very sorry to be apologizing. My country now is the dark in that power cut, electricity, all these problems are going on. That's what I couldn't make it today. All days out of the because of the petrol problem. Right. So what I want to tell you now, the complementary medicine to be developed, and there are various textbooks are available. Alternative complementary medicine. These slides you can connect it here. Connect this one more. Various textbooks are available, journal is available, and so we can update our knowledge and get that combined with the integrated medicines. So it's very helpful to the patients, and yeah, as we can help them. So my point of view that you see now these patients who is now I am treating the patient. Put the light. Can you see these patients? Uh, he is suffering from the osteoarthritis. How long have this problem? 1.5 years. 1.5 years he has a problem. After the 5 treatment, how many percentage better? 50 or 60 or 70? 70% he feel much improvement. I have to use the herbs oil and the light system of this physio and acupuncture and some supplementary I gave him and some exercise program. So the patients are feeling much improvement. No chemical medicine at all. But he followed the chemical medicine 1.5 years and nothing happened. And finally, vitamin D also we are giving for his supplement. So the patients are now 70% improvement after 7 treatment. So we are giving the dietary advice.